Essentially, it's a psychological condition that can develop following exposure to a traumatic event. Their mind and their body get stuck in a traumatized or threatened state where unconsciously they're constantly feeling unsafe. First group is intrusive symptoms, so that means intrusive memories of the traumatic experience, and that can manifest through thoughts, nightmares, even to the extreme flashbacks. The second cluster of symptoms is about avoidance, so avoidance of any reminders of the traumatic event, and that can be avoidance of certain people, places, situations, but can also be an avoidance of internal reminders, so trying to avoid your own thoughts and feelings about the event. The third cluster of symptoms then is about negative changes in cognition and mood. Those type of symptoms are things like your inability to experience positive emotions, your inability to feel emotions at all, so a sort of emotional numbing, your inability to experience, to enjoy things that you used to enjoy. And then the fourth cluster of symptoms is really about increased arousal and reactivity, by increased experiences of irritability, anger and aggression, hypervigilance, which is when you're constantly scanning your environment for danger, a sense of inability to concentrate on tasks, feeling increased startle response, which is that sense of being jumpy and on edge all the time, and then of course sleep disturbance goes along with that. The best way to talk about it is just the same way you talk about a physical injury. So just say you fall down and you have a knock to your head or a knock to your skull. You're going to have some symptoms. You're going to feel a bit dazed and confused. You might have, a bit of memory loss because it's a physical injury to your head. It's the same if you have a knock to your mind, which is essentially what a traumatic event is. You've had a knock to your mind, and that's going to leave you with symptoms. The GP is often the first point of contact for someone with a mental health difficulty, because obviously a GP writes the referrals to then the specialists. You say to your GP, I'm not feeling well, I'm not feeling myself, and then as best as you can describe what those feelings are, which might be, I'm feeling down all the time, I haven't felt happy in months, I'm yelling at my kids for no reason, I can't sleep at night. And then it's the GP's responsibility to, just as they do with physical health, to put together the pattern of symptoms and decide, okay, what's the best treatment plan and who do I refer to? PTSD is definitely curable. However, there are caveats to that, in the sense that if you have a one-off single trauma and you have a lot of other protective factors in your life, then most definitely it's something you can recover from. If, however, you have gone through repeated, ongoing traumatic exposures over the period of your entire life, then it becomes much harder to see it as a curable thing, because every time you go through a new traumatic event, it only amplifies and emphasizes the PTSD symptoms.